So this cat is not just fat, it's just its metabolism is lazy. So just pray for a faster metabolism in order to be thin. So that much important is metabolism. So this topic is metabolism of drugs. So which is otherwise called as biotransformation, which is otherwise called as fate of drugs. So biotransformation, with the term biotransformation, you have to understand that a drug is converted into a biological form, so that will be easily excreted in the kidneys. So that is the first reason for biotransformation. And the second reason is a drug will be given in a form and that will be converted into an active form, and that active form will be exhibiting the therapeutic effect. So in order to know these, you have to know the three terms. So first one is prodrug. So prodrug is nothing but it will be given in a form that will be converted into active form in the active metabolite in the liver, and that active metabolite will be exhibiting the therapeutic effect. For example, fosphenytoin, which is a prodrug, and that will be converted into phenytoin, which is an active metabolite, and that phenytoin will be used in anti-epileptic, used as an anti-epileptic drug. So next, moving on to the inactive metabolite. Inactive metabolite is nothing but they are polar form. So they will be in an inactive form. It doesn't produce any therapeutic effect. So they will be easily excreted in the kidneys. And third one is active metabolite. So active metabolite is an important metabolite which will produce therapeutic effect. But if it is in an increased concentration, that may also lead to toxicity. So these are the three terms which is necessary. Okay, let's move on to the this is a brief note on metabolism. So moving on to the detailed depth is there are two types of reactions. One is phase 1 reaction and the next one is phase 2 reactions. So you will be seeing here oxidation and conjugation. So the oxidation is, comes under phase 1 reaction and conjugation comes under phase 2 reactions. So phase 1 reaction is otherwise called as a non-synthetic reaction. So non-synthetic, with the term non-synthetic you will be understanding there is no any synthesis of any product, but that will be converted into a better form or better biological form or a better water soluble form in order to be available for the phase 2 reactions or in order to excrete in the kidneys. So there are reactions involved in phase 1 are oxidation. Oxidation is nothing but addition of oxygen or removal of hydrogen. And second one is reduction. Reduction is nothing but an addition of hydrogen or removal of oxygen. Next is hydrolysis, that is addition of water and breaking down the compound. And third one or fourth one is decyclization, which is nothing but cycle product will be breakdown into a straight chain, and cyclization is which is nothing but a straight chain compound will be converted into a cycle product. So these are the reactions. With these reactions it will be converted into more water soluble form and it will be available for phase 2 reactions. This is the importance of phase 1 reaction. So next, moving on to the phase 2 reactions, you have a conjugation here. So conjugation is nothing but one molecule will be combined with the other molecule and you will be getting a product, that is a metabolite, that will be an inactive metabolite. Mostly that will be an inactive metabolite that will be excreted in the kidney. So you have the process under phase 2 or glucuronidation. You will be adding glucuronic acid. You will these are endogenously available forms. So glucuronic acid, sulfuric acid, amino acids are the endogenously available substrates. So they are available already inside and that will be added to our drug and that will be converted into a form which is more water soluble, which is nothing but more inactive form. So that will be excreted again in the urine. So this is how the metabolism occurs. So phase 1 and phase 2. This is the importance of each reactions. So metabolism, the term metabolism itself, these all happen in the liver. So liver is the metabolizing organ. So metabolism takes place in other organs too, but major of the metabolism will be taking place in the liver. So what happens in the diseased liver patients? What will be happening in the diseased liver patients? So there will be no metabolism. There will be no metabolizing enzymes. So what happens to the when pethidine and morphine are given to the diseased liver patients? So there will be no metabolism, so there will be no excretion. So they will be showing a longer duration of action. So dramatically a longer duration of action. will be shown by these pethidine and morphine. So they are mostly metabolized in the liver, that's why. So next, moving on to the phases of biotransformation, that is nothing but not all the drugs will be moving to the phase 1 and then the phase 2 and then they will be excreted. So some drugs will be highly water soluble. Those drugs, after entering into the phase 1 reaction, they will be becoming more water soluble and then will be excreted in the kidney. And some drugs will be directly going to the phase 2 reactions and will be excreted. And certain drugs will be moving to the first to the phase 2 reaction and then to the phase 1 reaction. An example, a classic example of this drug is isoniazid, that is INH, which will be moving first to the phase 1 reaction and then to the phase 1 reaction, and then will be excreted in the kidney. Certain drugs will be in the highly water soluble form sometimes, so that will be directly excreted in the kidney in an unchanged form. So let's moving on to the enzymes. So enzymes plays a major role in the metabolism in the liver. So in liver you have cytochrome P450 enzymes. So these are the enzymes which acts as a metabolizing enzyme. So they metabolize the drugs which are administered, so that are responsible for the fate. So you have various families in cytochrome P450. In that, cytochrome 3A4 is responsible for 60% of metabolism of drugs. So 3 here indicates the family and A here indicates subfamily and 4 indicates the individual cytochrome. And here 450 nanometer, which is nothing but it's visible under 450 nanometer. So these enzymes you will be coming across for various drugs. For each drug will be metabolizing through each enzymes. So most of the drug will be metabolizing through these enzymes. So you have to remember the cytochrome P450 which are responsible for metabolism. So next, moving on to the enzyme inducers. So enzyme inducers. So what is meant by enzyme induce? Just induce the enzyme. If we induce the enzyme, what happens? Metabolism takes place. What happens when metabolism takes place? Also, right now they will be eliminating faster. When enzymes are induced, metabolism will be increased as well as the excretion process will also be increased. So this is remember mnemonic for enzyme induces. GPRS cell phone, that is nothing but griseofulvin, phenytoin, rifampicin, smoking, which is not a drug, and carbamazepine and phenobarbital. So these are the one which induces the microsomal enzyme, that is cytochrome P450 enzymes, and again they will be increasing the metabolism rate. So for example, when rifampicin is given along with the oral contraceptives, this rifampicin induces the metabolism of oral contraceptives. As a result, they will be easily excreted in the kidney and that may lead to pregnancy. So next, moving on to the enzyme inhibitors. So enzyme inhibitors, which is nothing but they inhibit the enzymes, so they slow down the metabolism process. So excretion process is not simple, it takes for a longer period of time, so they will have a longer duration of action. For example, you have to remember peacock walla, that is in enzyme inducers you have to remember GPRS cell phone, and for enzyme inhibitors you have to remember peacock walla, that is phenylbutazone, erythromycin, allopurinol, ciprofloxacin, omeprazole, cimetidine, ketoconazole, valproate. So these are the drug which inhibits the enzymes. So when you come across these drugs in the prescription, you have to check for the drug interactions and you have to check whether this drug inhibits some of the drugs. So and if they inhibit those drugs, their duration of action will be longer. For example, warfarin will be inhibited by the chloramphenicol, and that increases the warfarin toxicity. So this is how we have to check for the microsomal enzyme inhibitors and microsomal enzyme inducers. So you have to check for the interactions. So that's all about the metabolism process. So metabolism is nothing but a fate of a drug. You have two reactions, that is phase 1 and phase 2. Phase 2 is the synthetic and phase 1 is the non-synthetic. Ultimate goal is to excrete in order to become excrete in the kidney, and in order to excrete in the kidney it has to become water soluble. So these reactions takes place, and you have enzymes responsible for that, and that is cytochrome P450, and you have two enzymes, that is enzyme inducers and enzyme inhibitors. So in these mnemonics, that is peacock walla, and you have to remember the GPRS cell phone, and you have to remember the drugs. So you have to check with the prescription, so whether these drugs are inducing the other drugs or whether these drugs are inhibiting certain drugs. So you can verify the drug interactions. So and thanks for the wonderful participants in the teaching contest which we are conducting. So today is the last day, and you have done the excellent performance in providing the videos. So we'll be announcing the results soon. Thank you for watching. Thank you. Have a nice day.